Hello, this is Sittner Anderson, and I am the Communications Director here at MNCDHH. Today, I would like to talk about some of the work that has been done in September and October for communications. First, our contractor, Kaitlyn Mielke, has now resumed interviews for 2 communications projects. The first is the Can Do Anything campaign, which covers the work experience journeys of community members with a focus on communication strategies. We're working hard to cover individuals from all different walks of life and different perspectives, including individuals from Greater Minnesota. If you know of any individuals in your area who should have their story shared, please do connect them with Kaitlyn or myself. Another item that Kaitlyn has been working on are the community spotlights. The most recent spotlight is on the Minnesota Deaf Muslim Community, or MDMC. If you think of a community organization who should be spotlighted, please let myself or Kaitlyn know. Secondly, the Commission and DHHSD has started drafting a report that impacts the COVID-19 impacts on the deaf, deafblind, and hard of hearing communities in Minnesota. This report will cover impacts felt in education, housing, employment, healthcare, transportation, and law enforcement. If you have information that should be included, please contact me at my email address. My email can be found on the website if you do not currently have it. Third, we sent out a survey that was just drafted on our strategic goals so that we could collect some community feedback. Most of the feedback is from individuals who self-identify as culturally deaf. The second highest group is the hard of hearing community. Most responses were from the Twin Cities metro area. The second and third highest group were from Central Minnesota and Southeast Minnesota. There were 74 responses in total, but most only answered some of the questions, not all. So we have a different number of responses per question. Common themes that emerged have included a request that we do not forget about Greater Minnesota as a commission, concerns related to housing, including landlord-renter relations, and a request for a housing for deaf seniors, hearing aid affordability, a desire to see some legislative actions, more education on accessibility needs. Number 6 is anti-racist and justice-centered presentations and trainings. 7 is to continue our lobby day and legislative vlogs and videos, as well as voting and civic engagement activities. 8 are prompts to consider the needs of the hard of hearing or deaf individuals who either have limited or no knowledge of ASL. More town halls and virtual educational workshops. I'm trying to figure out what number am I on. I believe it's 11. And helping senior citizens adjust to emerging technology. 12 is to partner more with DHHSD and reduce any overlap. 13 is to continue to work on education, including IEPs and IFSPs. Addressing employment issues by working with business owners and business associations. a lot of misunderstandings about what RBA is and a request to use less acronyms. Number 16 is more efforts for diversity and inclusion. 17 is to educate healthcare providers about working with people who are deaf, deafblind, and hard of hearing. And finally, making sure that we reach out to all of our stakeholder groups and not just only a few. That was a lot of great feedback, so thank you all who filled out the form. We appreciate it. Fourth, we are excited to announce that we have a summary analysis on data about age-related hearing loss. This report summarizes 2 surveys, the Minnesota State Survey, MSS, and the Behavioral Risk Factor Surveillance Survey, or the BRFSS. We will soon be distributing this report and hope that this information will increase recognition as it relates to age-related hearing loss. Next, we've been monitoring and sharing information about federal action related to hearing aid affordability, which is important to many of us. First, the Food and Drug Administration, or FDA, is collecting comments about over-the-counter hearing aids. The Commission does plan to send comments with recommendations as it relates to their safety as well as their efficacy. We will send out a newsletter with a copy and encourage others to send their own comments as well. President Biden's plan to expand both Medicare and Medicaid. This includes a requirement for Medicaid to provide hearing aids. This is something that could make a big difference to seniors if this goes through. Currently, only 30% of seniors over the age of 70 could benefit from hearing aids who have ever used them. And finally, I will be spending less time on COVID-19 work now. I have remained in regular contact with the governor's office and with the Minnesota Department of Health regarding accessibility in their communications work. For example, I have advised MDH on their audio descriptions for videos. And that is all for my update. Thank you for your time. Have a great day. Hi, my name is Jesselyn Ackerman Frank, and my role within the Commission is as Community and Civic Engagement Director. Today we will be explaining what has been happening in the last month and a half. As you are aware, you have approved contractors that we have officially hired. We wish that we had more applications across Greater Minnesota, but we did not. Since hiring, we have been training on facilitation skills for our focus groups, what that looks like, how to use technology, Zoom, and facilitate appropriate questions. The facilitators who are contractors are working on focus groups. We have set our 4 focus groups. The groups are BIPOC, LGBTQ, hard of hearing individuals or individuals with hearing loss, and deafblind. These specific groups were set up because we were hearing from community members and board members alike that we needed more information from individuals who are often overlooked, or maybe were never invited at the table for a discussion. The focus groups have set up meetings, and the first meetings have been completed. The first meeting was in an attempt to get to know each other, do introductions, learn of new members who we have never met or been part of our work before. Our contractors have their networks and connections and have invited many of them. The second meeting, which will soon take place next week, will focus on the legislative agenda. Alicia will come to the meeting and present an introductory how a bill becomes a law. and at the same time show a potential legislative agenda. When showing this potential legislative agenda, Alicia will be getting a sense from the group if there is a strong opposition, support, concerns, and the value of specific agenda items to specific members. The goal is that their voices are heard by us, and this information will be brought to you, the board. The information gathered from the varying groups discussed will be shared with you as a board and will be aware of their feelings, needs, and concerns. And this will be there for you to decide, but understanding everyone's different perspectives from our different focus groups. The third focus group meeting purpose is to look at our strategic plan. The focus group members will look at our goals for needs, gaps, or what is overlooked for potential future projects. We hope to learn of what work is happening out there and if there are any projects that fit our goals that may need support or where we could partner with them. The goal is to get input from people who we do not often hear from, and we want to hear perspectives about our work. The focus groups have been keeping us very busy. A lot of planning and contractors that are doing a beautiful job. It's been a pleasure to work with them. Another part of our partnership is with the Secretary of State office, and their work has had a staff turnover. In the past, we worked closely with two individuals for a few years who are no longer there. And the new person who took over, his name is Simone. We have met to discuss what our future partnership will look like and learn about a lot of work that did not transfer to the new individuals. This is okay as we have set up a proposed plan to work on, and it includes primary elections for 2022, elections for 2022, ASL hotline that we've established to include deaf, deafblind, and hard of hearing, working together to educate on polling places, how to provide access and accommodations for deaf, deafblind, and hard of hearing. This includes how to use accessible voting machines. We have a deaf-blind contractor that works on that issue, focusing on accessible voting machines within Hennepin County. I think we have finished covering SOS and the work that we will continue. Lastly, we will share about technical support and technology. We have many requests by the community to have Zoom trainings and technical support. This is kind of our life right now. We see this as a positive thing because we are helping them do their civic duties. We do this by providing them with access to how to use technology. This supports them to participate in meetings, events, and future legislative trainings and testimonies. We feel it is important to share because there are not many who have this specific skill or expertise, and in that limited pool is our staff and our contractors. It was also mentioned in a meeting with the LLC, the group that we use their captioning services and interpreters, also the group that we partner with for Lobby Day. They mentioned that most future meetings will be taking place via Zoom. It is perfect how it is aligning with our work as we provide them with those skills, trainings, and how to use technology so they can support in our civic duties. And that is my report, so thank you for listening. Any questions, feel free to reach out to me. Thank you. Hello, I am here to give my government relations report. Today, the focus is on our 2022 agenda. I hope that you remember from our last meeting that I described the various ways we are gathering input on this agenda. Now I'd like to share some updates on our progress so far. We are gathering input in 3 ways. First, the survey is moving along. We are now doing some testing prior to sending out this survey. Note that today is November 3rd, so by the time you see this, you may have already received your finalized survey. The second way that we're gathering input is through focus groups. Again, today is November 3rd. Next week, I will be going to 4 different focus groups to present about the legislative process. I will also be asking groups insights on possible agenda items and asking what is important to them. Those first 2 activities will happen before the November 19th board meeting. So we will use those preliminary findings to inform our recommendation for priorities in our agenda. The 3rd activity will happen after the board meeting, likely around January. We are currently in the process of planning it, and we have not yet set a formalized date. The 3rd activity will be a town hall meeting. Our goal with this town hall will be to present the 2022 agenda to the public, as well as answering any questions they may have, plus listening to any experiences they have or may share related to the issues. Those stories could help us further refine our strategy for each agenda item. We're hoping to identify possible allies who are willing to collaborate with us to advocate on specific issues, whether it's testifying, writing letters, or other actions. That has been the progress thus far. Moving on, I want to explain a little bit about what to expect during the November 19th board meeting. For my report, we are reserving a little bit more time than usual. I'll start off by summarizing our findings from the survey and the focus groups. Next, I will review our recommendations for the 2022 agenda, answering your questions, and discussing recommendations. Lastly, I will turn it over to you all to vote on approval for the agenda. I'm looking forward to your questions and your discussion. I will see you all on November 19th. Hello, board members. My name is Danelle Guarneras. I am the Collaborative Plan Program Director, and this report will be sharing the work I've done from September 1st to October 31st. I have been continuing to work on the 4 strategic plans and goals that have been identified. The first of these being increased consistency in organization of the resources to ensure that children and families have access. The second is to collaborate and network across stakeholder groups to ensure that programs and services are supporting while not duplicating each other's work. The third is to promote mental health by using a whole child approach to help children develop a strong identity and ability to self-advocate. And lastly, to address licensure issues for deaf and hard of hearing teachers and ASL teachers. The first is to be increasing consistency and organization of resources. In a previous report, I explained about the Supporting Deafblind Children and Youth, the Data-Informed Strategic Plan. During my last report out, this had been completed but not yet released. But this quarter, this report was released, and it was sent out to both state and nation. Second, the Minnesota Department of Health has received HRSA funding to support the needs for deaf and hard of hearing newborns and toddlers. They would like to make a videotape project, and this videotape project is focused on making sure that the content that we as the Commission and our Birth to 5 collaborative groups have already developed, understanding that this content is currently in a printed form that can be found via website and other resources. That is often provided to parents of new children and toddlers who have been recently identified as deaf and hard of hearing. This currently does not include a videotape, so we will now be creating a new video in where we're taking previously made printed resources and turning them into videotape, sharing this with parents of deaf and hard of hearing newborns and toddlers. So Birth to 5 will be continuing on this project. The second goal is to be collaborating and networking across stakeholder groups to ensure that programs and services are being supporting of each other while not duplicating each other's work. We have the 5 collaborative groups, and I've explained that in a previous report. Birth to 5 group has already met on September 2nd. During this meeting, we discussed and reviewed notes from prior meetings and updated new information. The plan moving forward is to be creating the videotape project, and we will be taking responsibility as a commission. And the Birth 5 Collaborative will be reviewing and providing feedback to make sure that we make this as good as possible. The other collaborative groups, we have our 9th grade to transition age collaborative group, who is scheduled to meet on November 5th. And they will report out what has happened in their meeting. The kindergarten to 4th grade group, they will be hosting a meeting on November 17th. Those collaborative groups are ongoing. Outside of the collaborative groups, I have also been attending and overseeing different workshops and presentations and trainings for deaf and hard of hearing instructors. I am often there to make sure that the resources are supporting and collaborative work. Here are some of the workshops I have attended: the Deaf and Hard of Hearing Teacher Advisory Committee meeting, the MSAD Enrollment Task Force, the statewide Deaf-Blind Community Practice, Charting the Cs. This conference is for special education directors who have come together for a meeting. The National Deaf Center Midwest Regional Meeting, the My ASL Tech Workshop and training tools to support deaf and hard of hearing educators, the Tweens and Teens, which is supporting and mentoring emotional and social learning, and those are the workshops and meetings in which I have attended in a goal to support Minnesota's deaf and hard of hearing children, and I have overseen how they are working together. The third goal that I have been working on is to promote mental health using a whole child approach to help children develop a strong sense of identity and ability to self-advocate. I have set up meetings with Terry Wilding from MSA, as well as Volunteers of America's Jamie Monson. Jamie is the director of the Deaf and Hard of Hearing Services at VONA. The three of us had meetings discussing setting up a day program for mental health therapy. This program will be housed at MSA. During the summertime, those discussions were on hold. Now that we are back to school, we did a check-in about the needs and discussed plans for moving forward for establishing a day treatment program, trying to identify if it's possible, how it would work, and what are some of the gaps and barriers that we see. This discussion is also ongoing. The fourth is assessing and addressing licensure and qualifications. Because from previous advisory meetings, we know there's a concern about shortages in the deaf and hard of hearing teaching environment. I'm currently exploring reasons for the shortage, some of the barriers, the gaps, the recruitment efforts for deaf and hard of hearing teachers. I have also worked with the Executive Director for PELSB, the Professional Education Licensure State Board. And we have had discussions as a commission with PELSB about an ASL panel or evaluators who can review ASL portfolios for candidates who are applying for ASL teaching positions from K on. This work is also ongoing. I'm hoping to be completing this project soon. Thank you so much for watching my report. Hi, I am excited to give you an update about our goal number 5, strengthening our organization. There are 4 actions. First, developed a code of conduct as well as a conflict of interest form. Both of these have been completed, and Anne and Darlene have reviewed. We will release these forms when the ASL video is ready, as it is still in progress. I will be responsible for sending out forms and videos and then collecting signatures. So please keep your eye out for that. Second, I have started working on a grievance process. The board requested that Darlene do that, and so we've looked over. Darlene and I have decided to go ahead and modify it slightly. It is still a grievance process at its core, but we will be calling it a complaints and compliments form. So this will still be submitted online through Alchemer, which is our online survey software. And that will be helping us track all complaints and compliments sent to us. We want to make sure that we are knowing exactly where we've done a good job and where we can improve. And so Alchemer will help us be able to track all of this information. Third, the RFP for the Hard of Hearing project is finally been posted. And we are looking forward to seeing who will send in submissions and see what we will be doing together to help the hard of hearing community. We're very excited for that. And finally, DHS is still trying to identify the numbers for the pandemic to see when we can move into our next phase of 2 or 3 for employees back to office. They've let me know they still have not decided on this yet, and so our commission is still teleworking from home. If you have any questions or concerns, please contact me. Thank you.